If you've received confusing mail, if your Medi-Cal just ended, or you think that Cover California has a high premium and it's very expensive, this video is made just for you. So, as a Cover California agent myself, my name is Andrew Lee, and I just got to be honest. Some of you guys do qualify for coverage and you're just missing out on it, right? And it's not your fault. It's the system, it's the confusion of it all, it's the lack of straight answers. And even worse, a lot of folks don't know that they've made a mistake on their health insurance or the application until it's too late, until they actually have to use their coverage. So I'm going to explain why a lot of people don't enroll, and why that decision can cost more in the long run than it would short term, right? So a lot of well, let me start with this. Here's the reason why you're hearing from Cover California and you're not hearing from Cover California. So many clients don't know to renew if they're on Medi-Cal, their income, right? And also their application itself. So if you're making too much money, again, the federal poverty level changes every year with Medi-Cal as well too. So if you hadn't reported that, or you hadn't renewed your Medi-Cal, and then all of a sudden you were kicked off of it, then you're newly eligible now for Covered California. So there's been a wave of people getting their Medi-Cal renewals failed because their income increased, right? That's just the simplest way to put it. But again, it's because of the whole post-pandemic Medi-Cal redeterminations. There's also a gap of coverage because there's been notices sent out, but a lot of people have not responded to it, or they didn't actually get one, right? Sometimes they'd be dropped without notice. This is a real problem that we are facing here at our agency and just in general, right? From what I've heard. I had a client, her name is Jocelyn, and she thought she had a Medi-Cal policy, and when she actually went to the doctor, they denied it, right? Straight up, right? So the the real reasoning, how we found out, is because there was no response to the mailed renewal, right? So because there was no response to that, she is now going to qualify for Cover California at the very least, right? If you're getting kicked off of Medi-Cal. So if that's the case, and her income did go up, so she did qualify for it. So why don't people enroll then? At that point, if you already know that you're not covered, why won't people enroll? Well, a lot of people are missing out on enrollment because they don't know that their income can be flexible, right? If you go on and try to quote yourself, the income question can be very confusing because they're asking for the projected income, the expected income for the full projected year. Again, we don't know how much money we're going to make. I don't know how much money I'm going to make, throughout the course of the year, throughout the rest of the year. So I know that it is sort of a hard question, but I don't want that to hinder you from getting coverage. If you need assistance, of course, reach out to me at 323-844-8471. More than happy to do this. We do this every day at our agency. We help navigate your income with you, no matter where you're at. 1099, if you're a W-2, if you're an LLC, S Corp, whatever the case is, we help out with that. So a lot of people don't know that they can enroll even after losing it, right after losing employer coverage, right? So there's going to be the Cobra option. I can get into that in a second here, and also the Cover California option. And they've probably heard of myths about who qualifies, or they're sort of scared of paying back the IRS on subsidies that they might have thought that they used up, right? But in reality, we did a pretty good job on navigating the income portion, or at the very least following up. If the income does change, of course, there's nothing to be afraid of. It's just that they're going to be more overwhelmed initially. But it's, easy to consult a an agent like myself, it's also pretty easy to do nothing, right? So it's sort of pick where you want to go, right? I would definitely consult an agent because we do all the heavy lifting for you so that you don't have to go through all this. This is the whole reason why we exist. We don't take any money, we do this essentially for free, right? We get credit from the carriers that you end up going with. So no skin off of your back. Again, I've seen people go bankrupt from just unexpected medical bills, people being out of network when they're supposed to be in network. So there's levels to this, there's nuances to health insurance that a lot of people don't know until it's too late, until there's a huge bill that comes their way and they're like, what the heck is this? Andrew, I had this situation happen. I don't know why I have to owe so much. I was like, well, I wish I would have talked to you 6 months ago. We could have definitely mitigated some of these amounts and some of these risks. So, again, if you're getting coverage for under $100, which is a pretty good deal these days, that could have saved you thousands or hundreds of thousands worth of hospital bills. So those are the people that I feel really bad for and I have a heart for because it was something that I could have done very easily for you. And unfortunately, we were put in this situation and now we're in this whole situation where we have to pay back the hospital, there's bills, all that. So we do not want to be in that position, especially if you qualify for a subsidy and your income is going to qualify you for a pretty good premium, then why not take it, right? It does not hurt to consult an expert like myself to see if we even do qualify, right? Now, here's some reasons. Here are my top 3 reasons to switch to Cover California, especially if you're in that Medi-Cal situation and you just got kicked off. But the reason number one would be, tax credits, right? Subsidies are much higher now. Before, they didn't give $0 silver plans to people who had higher income, $0 deductible silver plans. Now they do. In certain areas, we will have $0 silver plans as well too, but I'm more mentioning the deductible more universally throughout California. So the Silver 73 has a $0 deductible and also a lower out-of-pocket maximum than the Gold plan. It's 6,100, whereas the Gold is around the 8,700. So a little hack for you guys, if you guys are shopping Gold versus Silver, that could be the biggest difference there. So I've seen people go from 1,200 a month with their, let's say, their employer coverage that they had, and also from there go into Cover California, have their income changed because they had a job change, right? So their income is now going to change because of that. So since their income is lower, I've seen people go from like $1,200 to $50 a month based off of that because, they've lost their a portion of their income or they were just getting off of Medi-Cal, right? So just letting you know that it does not hurt to check, right? Number 2, you can choose your own doctors and pick your own plan. Unlike Medi-Cal, where you're restricted to X amount of carriers and they choose it for you, you are now a private insured, right? You're privately insured through a carrier and you are getting subsidies through the state exchange, which is Cover California. You're now getting subsidies through them so that your favorite carriers and the doctors that you like are still all going to be there with all of the options that are offered through Cover California. It's just that now you can choose it. Okay. Now, number 3 is it's safer than being uninsured. Let's just call a spade a spade. I mean, if we don't have insurance, we're gonna be in a loop, especially if you're not qualified for like a Medi-Cal case or something like that. Then guess what? We're just uninsured. We're paying a tax penalty in California for not having health insurance. And at the same time, we don't have health insurance, which is a huge problem, especially again, if we're in a situation where we need to go in for hospitalization, specialist visits, lab work, everything else in between, right? So that's going to be the most important part. One ER visit without insurance can wipe out your savings. I mean, let's just be completely real about medical bills. That's the number one reason why people go bankrupt in this country are medical bills. So my job is to stop that. My job is to mitigate anything that is going to have you pay so much for something that you deserve, right? So I'm not going to let that happen. So of course, reach out to me and we'll talk about that. Cover California has bronze plans all the way up to platinum. We'll figure out which one's going to be a good fit for you. So when people think that they don't qualify, it's just or they think it's going to be too expensive, or if they have employer coverage or something like that, it is just what it is. But, truth be told, I mean, Cover California, it does have its own rules. It does have its own exceptions. And you're going to have to really understand how this works because without this understanding, we have no idea what we're going to navigate through in terms of our health insurance coverage. And again, what to avoid, what to do. Are there any documents that I do have to upload? Is there anything pending that I have to do on my end? There's so many things that can go into a Cover California application. Hence why it's a heck of a lot easier reaching out to a representative like myself so I can walk you through it in plain English, right? I'm not gonna make this more harder than it's supposed to be. I'll keep this very simple, very light, and it should be a pretty easy process, just depending on your situation. Okay. So I would say, some advanced tips that I have for you guys are report your income carefully. Okay. So I understand that if you're legally structured in a certain way, again, if you're an LLC, if you're an S corp, if you're 1099, if you're W-2, if you're on Social Security, whatever the case is, the amount that you're supposed to provide, not all income is going to be created equally. So we have to figure out what will qualify for subsidies and what won't, right? And I can definitely help out with that, right? You get one number wrong on that, and that could be tens of thousands of dollars if we just made the slightest mistake on the income there. So just make sure that we're doing the right thing there. Realistically, hundreds per month, but I've seen thousands. Um, Also, there are special election periods still, right? There's still qualifying life events. Hey, did you move from another states? And are you still within 60 days of that? Did you just lose your coverage through work? Again, Medi-Cal. That activates a 60-day window where you can where you can enroll into a policy outside of open enrollment, the traditional open enrollment, and you can do this in the middle of the year, so you can enroll now if you wanted to. Now, I would prepay to activate the policy as soon as you can, right? So the sooner you pay your premium, the sooner you get your cards and your brochures in the mail, right? And now at that point, you have some time to choose your own doctors, choose the medical group that you want to be a part of, and work that out just so that they're accepting new patients. You have a little bit more rapport with this doctor. These are the full steps of getting the plan that you're going to stick with, not just have it and then say, this is not worth my money, this is not worth my time, this is not good coverage. Before we get to that conclusion, we want to make sure that everything works out for you, right? So we customize your policy. Now, know when not to enroll as well, too. Okay, so if you know that your income is going to be $0 and it's fixed every month, guess what? We're going to be on Medi-Cal. It is what it is. We can't really make any adjustments to a fixed $0 income, or if you're, in a situation where, you have to be low income and it's not going to qualify you for Cover California, that's not gonna make you eligible for Cover California. So just make sure you know when not to enroll. Just have a consciousness about, what your actual enrollment periods are and what your eligibility is. If you have questions about that, please let me know. So I know insurance really isn't the sexiest topic and something for you to get very excited about and talk to me about, but it is confusing at the end of the day. right? Anybody that's shopped for any type of health insurance, especially subsidized health insurance, there's a lot of questions, and you know that it's not just something that you're an expert at. We've been doing this for 11 years, so we are technically experts at this, right? So we can definitely take away the stress factor of all this. It's very easy for us to do this. So we want to take away all the stress factor. We want to make sure everything's in line so that when push comes to shove, it's easier to ignore a problem later on because you're already covered than having to deal with it on the spot, right? So that's why having somebody in your corner is going to make that difference, right? It's free again to work with us. So as a certified Cover California agent, our job is to find you the best plan at the best price with no guesswork, right? Just just make sure the plan is set up correctly initially so that in the future, when you do have to use your coverage, we're not scrambling. We are actually using the coverage and it's working out. That is the goal. So I'm here to guide you, explain whatever questions you might have, explain really what's going on behind the scenes with just what's happening with legislation, what's happening with the state, if there's any other qualifying life events. There's a lot that goes into this that we do know, and we're happy to share that information with you, especially with our clients, right? So if you're, you know, in a situation where you're in a bind where you think that you chose the wrong plan, or if you thought that you missed a deadline, or you accidentally triggered something on the application, or something was a little bit confusing, then of course let us know. So basically, what I do for you guys is, you get real help and therefore turns into real results, right? So what I basically do is I help you figure out if your employer coverage disqualifies you from Cover California. There's ways that you can still get Cover California with employer coverage. Please let me know and I'll walk you through how that works. I could also tell you exactly how much you're gonna pay for and exactly how much your subsidies are. I could also recalculate your income if it changes mid-year, let's even call it, right? Because you don't want to get stuck with paying back and, always looking over our shoulders with the IRS, right? You need a game plan. And if anything changes in the middle, we need to adjust, right? We need to do an audible, right? We need to have another plan in place. That's, again, where I come in. Also, explaining IRS language in plain English, right? And sometimes when you get that 18-page docket from the IRS talking about Cover California, you're like, what the heck is this? I just want my 1095-A form. Why are you sending me the encyclopedia, right? So if you want us to just shorten that up for you, of course, that's what we're here for as well, too. If Cover California themselves had an error or made a mistake, or maybe you did it on your own, happy to take a look at that. And then if we have to proofread anything or let you know, hey, this is a section where, X, Y, and Z, we put X, Y, and Z here. This is actually the wrong information. You're actually supposed to put it over here. Then, of course, we guide you through your current application. Even if you are a current Cover California enrollee, we can still help out with your current coverage as well and be your agent of record if you do need help with your coverage moving forward if you don't have an agent. So again, we can help with, again, renewals. That's going to, of course, come with us being your agent. We've got to remind you, plan changes, and then if appeals or anything goes wrong, then you let us know. We'll help you out with this. You don't have to do this alone, obviously, right? This is something that I do every single day. I know how to navigate the system. Cover California agents like me. Does not cost extra to do work with us or have us work for you. So it's no skin, again, off of your back, but our job is to help you save thousands of dollars. That's my goal, is to save you money, right? And if you're going to try to figure out on yourself, and if you're autonomous, you can do that, but before you do that, or even after you do that and find out that this is not the easiest thing to navigate, then reach out to me. Let's do this together. let's make a team together and let's look at the same screen, and then I'll customize your policy for the way that you need it for what your specific needs are. So again, if you are uninsured, you've already applied and you're sort of in limbo, and or you haven't gotten responses, or you just don't know where to start, go ahead and message me or call me at 323-844-8471. Feel free to comment below as well too, like the post, and we'll have a real conversation about your options, right? We'll have a real candid, we'll go over everything, right? So again, no pressure if this sounds overwhelming or it's just, again, I don't want this to look like it's scammy or spammy or pressure. I'm applying pressure here. I just want to make sure that you guys understand what the heck is going on with your policy so that in the future, we're not, spiraling and escalating and, getting the county involved, getting the state involved, getting the exchange involved, and getting the carrier involved, just so we can avoid that. Feel free to give me a call. Of course, I'll be your advocate on this. Again, 323-844-8471, or my email at andrew@healthmutualnetwork.com. Please like and subscribe to our channel, and I'll give you more content that's going to help out with your health insurance. Thanks for watching.